In 2023, we're estimated to have 2 million new patients diagnosed with cancer, and about 1.2 million of these patients are going to qualify for agents like immune checkpoint inhibitors. And about 15%, about 180,000, can get an endocrine toxicity. Now, when you look at the mammoth size of this patient population that can get an endocrine side effect and go into the hospital, you really want to address that at the beginning of when these toxicities develop. I was answering a lot of messages about toxicity management, about how to take care of patients over text, over phone calls, and over emails. And I realized that the interventions that I was doing were actually impacting patients. We were preventing hospital admissions. That's how I decided to launch the electronic consultative service, and we called it the Duke Endo-Oncology e-consult service. We were able to drive down the hospital admission rate down to 2%, so about a 70+% reduction in hospital admission rates. So not only were we getting the right patient in at the right time, seeing the right experts, we were also saving the system hundreds of thousands of dollars.
Recently, with the advent of immunotherapy, the need for expertise in endocrinology has just exploded.
I started coming here to Duke after I was first diagnosed with melanoma. I have had a reoccurrence of the cancer, starting off with treatment for immunotherapy. And after the second treatment, going into my third, our oncologist came in and said, right now you're in a diabetic ketoacidosis state. Your blood sugars are over 500. But we had to make a determination after that treatment that I was either going to be submitted to the hospital for treating my DK, or we would potentially treat it in a different way.
So when an oncologist suspects that a patient has an endocrine toxicity, they place an electronic consult to the Duke Endo-Oncology e-consultative service. We review the cases within about 24 to 48 hours. Oncologists were waiting 61 days on average to get recommendations from us. Now they get it within 1 to 2 days.
E-consults allows for a quick triage. Usually a referral can take weeks to months, and through this program, a patient recommendations can be given back same day, next day. It might be treatments that need to be started, or it might be, no, I need to see that patient this week by video or in clinic. So everybody wins.
I was able to be handed from my oncologist to my endocrinologist, and it was there that I was able to receive IV infusions. They were able to remediate my DK state. I was actually able to get released that day and be able to take care of my soon-to-be ongoing diabetes diagnosis from home.
And that's the really beauty of this thing, is that this creates for us a dialogue. It's really, a paradigm shift in how we think about, consultation in general in medicine.
Making it simple, making it easy, making patient-centric is what we're all about.